Hello, and a warm welcome to Nourish Mental, where we post videos talking mental health, getting therapy should you feel you need it, and everything in between. Today we're going to be talking about how cognitive behavioral therapy works. If you'd like to learn more about what it is and how it works, keep watching. Now let's get into the video. And as always, captions are available if you need them. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that helps people change their negative thinking and behavior. It is based on the idea that our thoughts, feelings, and behaviors are all connected. If we can change our thoughts, we can change our behavior. For example, if someone is feeling really anxious about going to school, the therapist might help them figure out what thoughts are making them feel that way, and then help them come up with new, more positive thoughts. It's also been shown to be effective in treating many mental health disorders, including anxiety and depression. What is cognitive behavioral therapy? Cognitive behavioral therapy is a type of program that helps an individual to change their thoughts and actions in order to be more successful. The goals of cognitive behavioral therapy are to help people learn how to manage their emotions, deal with stress, and make better decisions. If you're struggling with mental health issues, you may want to consider getting cognitive behavioral therapy. Here are 3 signs that CBT may be right for you. 1. You have been diagnosed with a mental health condition. If you have been diagnosed with a mental health condition, such as anxiety or depression, CBT may be an effective treatment option. 2. You are not responding to other treatments. If you have tried other treatments to help improve things and have not seen changes, CBT may be worth considering. 3. You are struggling to cope with stressors in your life. How does cognitive behavioral therapy work? CBT is usually conducted in weekly sessions lasting 50 to 60 minutes. During these sessions, patients work with their therapist to identify negative thinking patterns and replace them with more positive ones. Patients also learn skills to help them better manage stress and cope with difficult situations. The primary goal of CBT is to help you understand how your thoughts, emotions, and behaviors are related to each other. Throughout the course of treatment, you'll learn how to change your thinking patterns and behavior. What are some benefits of cognitive behavioral therapy? Firstly, this treatment can help you to identify and change negative thinking patterns. This can apply to any part of your life you feel you are struggling with or could improve upon. Secondly, you can learn to develop healthy coping mechanisms for dealing with stress and difficult situations. Unfortunately, stressful times will always be coming and going, so knowing how to deal with negative situations in a way that works for you is a hugely beneficial life skill to have. CBT also can help you to manage your time and set realistic goals. No matter what your goals may be, being able to navigate difficulties effectively will help you to stay more consistent and to reach your goals faster. Another great benefit is it can help you to improve your relationships with others. Knowing why you do what you do, and understanding how your brain works will help you empathize better with others, as well as being able to help them understand you, and potentially even help them see patterns in their own behavior that they may not have noticed before. The efficacy of cognitive behavioral therapy. Cognitive behavioral therapy has been shown to be an effective treatment for a variety of mental health disorders. The main aim of cognitive behavioral therapy is to help patients identify and change negative thinking patterns and behaviors. A recent study found that cognitive behavioral therapy was as effective as medication in treating patients with depression and anxiety. The study found that patients who received cognitive behavioral therapy had a significantly lower rate of relapse than those who did not receive any treatment or medication. How to find a cognitive behavioral therapist. If you are looking for a CBT therapist, there are a few things you can do to find the right one for you. First, ask your primary care doctor or another mental health professional for a referral. You can also search online directories, or look at people who may specialize in the issues you're struggling with. When searching for a therapist, it's important to make sure they have experience treating your specific condition. Once you've found a few therapists who meet your criteria, give them a call to ask about their availability and fees. It's also important to make sure you feel comfortable talking to the therapist and that they offer services that meet your needs. What to expect when doing CBT? During CBT, patients work with their therapists to identify negative or distorted thoughts and beliefs that may be contributing to their distress. They then learn to replace these thoughts with more realistic and positive ones. CBT also involves learning new skills to help patients cope with difficult situations and make healthy choices. Many patients who undergo CBT often find it to be a very effective treatment for their condition. All things considered, CBT therapy is an effective treatment for many mental disorders. The therapist works with the patient to identify and change negative thinking and behaviors. CBT has been shown to be effective in treating depression, anxiety, eating disorders, substance abuse, and schizophrenia. If you're considering CBT therapy, talk to your doctor or mental health professional about finding a qualified therapist in your area. Cheers for watching. If you haven't yet and you fancy giving a like or subscribing, go right ahead. Have a wonderful day, and I'll see you in the next video.